The latest surge in COVID cases is taking us to some grim milestones. The U.S. had its deadliest day ever on Wednesday, with fatalities topping 2,600, and hospitalizations in the U.S. passed 100,000 for the first time. All of this as both the U.K. and the U.S. are on the brink of administering the first vaccine. So what's next? How will hospitals keep up with demand while also administering vaccines to the general public and the people who work there? Joining me now is Nisa Ernst, nurse manager of the biocontainment unit at Johns Hopkins Medicine in Baltimore. Nisa, it's always great to have you on Quicktake. Thanks so much for being here. I want to start with the surge in hospitalizations. As a nurse manager, you know firsthand what an influx of patients certainly means for healthcare workers. So just give us an idea of how hospitals are handling this, and are they more prepped this time around than they were in the spring?
Yeah, as a matter of fact, right now I'm here with my team planning how we are going to manage to keep a procedure area open while we have nurses able to be staffing bedside care. We are more prepared in Surge 2.0. We did a lot of lessons learned, and some of those lessons learned were, how do we keep registered nurses at the bedside? And a lot of places have done some very innovative projects. In the state of Maryland, we are actually having college students handle some of the call volume in our call centers, for instance, in occupational health.
So what that does, I take it, is allow the people who used to be doing that to actually be physically with patients, right?
That's exactly right. And again, this is what we learned from the last surge, that the more that we have at the bedside of our highly prepared clinicians, the more care we can deliver to patients safely with less stress on both the institution, the patient, and the provider.
And the stress is something I want to hit on with you, Nisa, because we've heard a lot about the declining mortality rate in the United States of COVID, but at the same time, those stats happened when hospitals were not overrun. So how does it change, and how does the mortality rate of COVID change when people who work in hospitals don't get to spend as much time with patients and perhaps have to spend time with more and more patients and less with individual patients?
Well, look, we know the data says that the lower nurse-patient ratio, the better the outcome. And so again, that's why when we look at innovative ways to extend our healthcare providers, the more time a registered nurse or a nurse practitioner or a physician is able to spend in direct patient care.
I'm curious about what you've heard about the vaccine, because what we do know is that people on the front lines, like you and the staff at the hospitals, are the ones who are going to get the vaccine first, along with those who are most at risk for mortality from the coronavirus. Have you actually heard yet when you're getting the vaccine?
We have not heard, but what we have talked about is a lot of transparency in the science behind the vaccine and making sure that we're focused on the science and making the best decision that we can for ourselves and our families. The vaccine is not mandatory here at Hopkins. There is going to be a process. We're going to be talking about that. We talk about that almost every single day. But the message that I get out to all of my fellow healthcare workers and my community is learn about the vaccine, see which one is best for you, and when the opportunity comes up, get the vaccine.
What does the vaccine mean for you and your team?
Oh my gosh. You know, I don't want to say that it's a silver bullet, but it's going to be so helpful, because part of our problem with staffing is healthcare workers getting sick. And you're talking about removing an experienced clinician out of the front line for anywhere from 7 to 21 days. That's impactful.
What went through your head yesterday when you learned that it was the deadliest day in the United States since this crisis began?
I had to take a deep breath. And I have to say, this is a very dark place for us as healthcare providers, as a country, as a nation, and as a world to be in. I'm tired, but I'm also battle tested. We have been through this. We have to put our heads down, take care of our patients the best way we can, get the vaccine, and be hopeful.
What does the rest of the month look like for you? How are you preparing for it? How is your staff preparing for it?
Every day, we talk about preparing for the worst and hoping for the best. So we're very clear that there is going to be some level of engagement, deployment from all of our nurses here at Johns Hopkins Hospital, getting as many of them at the front line as we possibly can. We have very clear plans. And again, there's a lot of transparent communication going out to staff to be able to identify what do you need to make yourself successful at the bedside.
I know a lot of people right now are thinking as we get closer and closer to the holidays in December about seeing their families or not seeing their families. What is the message that you have to people right now who may be thinking about traveling to be with family during a time when public health officials are warning against it?
You know, you have to lead by example. I am not traveling at Christmas time. Not in 2020. In 2021, things will be different. But we need to, as a community and as a nation, and really as a world, to say, our choices have got to be different this year. And we're going to get through this. And my individual need to go see a family member does not trump someone else's need to not contract the virus, or for me to have a healthcare worker who can't be at the front line because someone in the community has transmitted the virus. So I think globally, we really need to look at this holiday differently. I know you mentioned the Pope before. You know, one of the things they're doing at the Vatican is scaling down their whole Christmas event. That's a message we have to follow.
Yeah, talk about leading by example. What are you telling the nurses on your staff who come to you and say, this is the hardest thing I've done in my career? What do you tell them to help them get through it?
I actually review with them some of the comments that their peers have given from their last deployment. And their statements like, this was really difficult, but I'm so proud of the way that I learned something new and I was able to take care of these patients. You know, nurses have done this for a long time. We're very innovative. Again, we're battle tested. We're tired. We all want to get through this. But there is hope. And I talk a lot about hope. And I don't mean a false sense of, you know, Pollyanna hope. I mean a hope that we have some really good science. We have some really good leadership. We are in a much better place than we were January 25th of 2021.
All right. Anissa Ernst, nurse manager of the biocontainment unit at Johns Hopkins Medicine in Baltimore. Thanks so much for your time. We really appreciate it this morning. And we should note that the Johns Hopkins Bloomberg School of Public Health is supported by Michael R. Bloomberg, the founder of Bloomberg LP and Bloomberg Philanthropies.
Thanks so much for watching Bloomberg Quicktake News, where we bring you the biggest stories the moment they happen from around the world. Don't forget to click the video if you want to see more of our latest coverage, and subscribe to Bloomberg Quicktake News to get insight in an instant.